So when you do a physical exam, the first thing you want to do is take the temperature, just in case they get stressed out during the visit and the temperature rises for no apparent reason and it doesn't raise any concerns. So to take a temperature, you're going to take your thermometer, and you would have a little bit of lube on a gauze with you as well. So you would roll the tip of your thermometer in the lube, so that's way it's easier access for the rectum. And then you're going to turn your thermometer on, and then you're going to insert it into the rectum, but make sure it is touching the wall of the rectum and not just straight in, so that way you can get an accurate temperature. And you're only going to stick it into about the metal part there. So you're going to hold it there for a couple of seconds until your thermometer beeps and it tells you. And our friend Cruiser's temperature is 101, which is within the normal range for a dog, which would be 100 to 102.5. And then you're going to walk back up to the front here, and you kind of just want to work your way down the animal. So the first thing we're going to look at is Cruiser's mouth, and you want to make sure that there's no problems with the teeth, and the teeth are clean, no tartar buildup or anything, or rotting teeth. And make sure the gums are a nice salmon pink color. And to check the capillary refill time, you would just lift up the top lip of the mouth, press your finger down, and then take it off and wait for the color to come back, and it should be less than 2 seconds, which Cruiser's is. And you're going to want to check the nose and the mucous membranes to make sure that there is no excessive discharge, make sure they're normal, which they are. And then look at the eyes, and just to make sure that there is no redness, swelling, or discharge, or any major concerns with the eyes. And then for the ears, what you do is lift them up and smell, and you want to make sure that they have a wet dog smell, which is normal. And they do, and make sure. So then the next thing we are going to do is look at his ears, and you're going to want to smell them, and you're going to want to smell a wet dog smell, which is normal, nothing like yeasty or abnormal. So he has a normal smell, and you're going to want to look at the pinna and the auricle, make sure there's no like scratches or irritations or redness or swelling or any flea dirt. Just normal. And then look at his skin and make sure it's not excessively oily or anything. Yeah, you just move the hair, lift up the hair. He has normal skin. So the next thing you want to do is look at the limbs and just kind of run your hands down them. And then also look at the paws and make sure that there's no scratches or cuts or scrapes or anything. And look in between the toes. Make sure that they all look normal. And his feet don't bend the right way, but that's okay. So all his limbs are normal. And then the next thing we're going to do is listen to the lungs and the heart. So the next thing we're going to do is feel for the pulse and listen for the heart rate. So when you use the stethoscope to listen to the heart rate into the lungs, you are going to have your earpieces, pointing forward, and you want to use the diaphragm to listen properly. And for the heart rate, you are going to feel on the left side, right on the back of the front arm, and you are going to listen for 15 seconds and then take that number times 4. So Cruiser, you counted 25. So 25 times 4 would be 100, which is within the normal range of $60 to $164. And then for the rate, you are going to feel on the inside of the leg, and you want to feel for like a lub-dub tap a little bit. And you are going to also take that number times 4, and the normal rate is 60 to 160. And the next thing we're going to do is listen to the lungs, and again, the earpiece is pointing forward. Use the diaphragm, and you are going to listen up here and down here for the lungs. And you want to hear like a rustling of leaves sound, which is normal and good. You don't want to hear any like raspy breathing. So that's good. And then also to figure out the respiratory rate for a dog. On a shorter haired dog like this, it is ideal to listen. So while Cruiser is getting other work done, I can show you how we write in a medical record. So since Cruiser is a new patient with us, we are going to start a new file for him. So for the owner's name, we're going to put Ridgewater College because he's part of the college with us. And the pet's name, which is Cruiser, the address, which is Ridgewater College in Willmar, Minnesota, 56201. And then you would also write down the phone number, business, cell for the owner. But in that case, we're not going to right now. And then his species is a canine. He's a Labrador Retriever for breed. He's a black color, and we don't know when he was born, so we need to double check on that with the owner. And then he is a male, is neutered, and if he has any vaccines, you would put them right here. And then in the progress notes, you're going to want to write them right here. And then in the progress notes, you're going to want to write down anything that you did to him. So we're going to write down the date, which is December 9th of 2022. And then for his temperature was 101. His pulse and heart rate was 100 beats per minute, and you're going to want to do a capital B. And then his respiratory rate was 20 breaths per minute, which is a lowercase b. And then his capillary refill time was less than 2 seconds. And the rest of the physical exam was within normal limits. And then you're going to want to put your initials and also his weight that we took earlier, which is 30 pounds. And why you put your initials is so that if anybody else has a question about Cruiser, they know to come to you. So now that we can return Cruiser to his owner. So after we return the patient to their owner, we can clean up our work area. So what we would do is use any disinfectant that you use. We use Rescue. We would spray down the mat, roll it up, put it in the sink here, and rinse it off. And then put it there to dry. And then spray it down our table that we use with the Rescue, just so that nothing gets transmitted from animal to animal, and to make it more comfortable for everybody to work in a nice, clean environment. And we're going to throw this away, and then we go here. We're going to wash our hands. So then what you want to do is make sure you have enough soap on your hands, and then make sure to wash for 20 seconds or sing happy birthday or sing the ABCs a couple of times. And then take some paper towels and dry your hands, and then take the towels to turn the faucet off.